And we're back with another NHS podcast, and I have Dr. Jack Myers with us, and we're going to talk about 2026 goals. What's up?
Oh, what's up with you? It's been a year.
It has.
Yeah, I have radically transformed on so many levels from this. We started doing this about a year ago.
Yeah.
Right? And I was losing weight, but I didn't know the underlying reasons that I was dealing with, and then I figured that out, and then we started talking about that, and I've been incorporating a lot of that into my practice, but it's been spreading through my family and friends and through my patients and through the hospital, and there has been a lot of things that have happened, and I'm super proud of it. We have a lot of work to do. Like, it seems like the more I come to understand this, is the more I want to get involved and try to change things. But this time last year, I don't know how much weight I'd lost, but I'd lost some. But and I had thought that something was broken in me. Like, I don't know what's wrong with me, but I just can't eat carbohydrates. I knew that if I cut carbohydrates out, I could lose weight. And I'm like, I don't know what it's going to do to me, but I'm just going to send it. I'm just going to not eat carbs, and I don't care what it does to me, but I'm done being obese. I hated that. I didn't know that my obesity was just a symptom, of like many other symptoms that I had going on. I had asthma, which was terrible. I had arthritis. I had migraines, anxiety, depression, reflux, sleep apnea, high blood pressure, skin problems, allergy problems. There was just a litany of things, and all of those started to get better. And then I finally put it all together that the problem that I was dealing with, and the problem that basically the entire country is dealing with and completely unaware of it, is its insulin resistance. And so, but it is by far the biggest problem health-wise in the country, and it's just completely ignored. And so I've been on a tear about it, and I've been as vocal as and I'm typically not a vocal guy, but that part has changed. I've been very, very, very vocal online about this, and very vocal in the hospital, and very vocal to anybody that'll listen, that this is our problem, and this is our pandemic. This is what's killing us. And so anyway, so I figured that out. I've lost 130 pounds. I've lost all of my medical problems. I don't take any medicines. I don't wear a CPAP. My blood pressure's perfect. I had a CT coronary scan. It was perfect. My labs are perfect. I'm still overweight, and I'm working on it. I had to have a surgery a month ago, which has hampered my activity, but I'm about healed up from that, and then I'm going to get back after it. So I'd like to lose the rest of my overweightness, but man, I'm healthy otherwise,
right.
And I feel good, and I'm a totally different person now. I'm a different doctor now. I spend in the surgery clinic way more time talking to my patients about their overall health, the root cause of their problems. I spend time talking them out of surgery, at least for the time being, to try to get them in a better spot until we can put them in a much better position to have a surgery if they need it. Sometimes they don't. And then I also see a lot of people for this reason, because the word's out, hey, if you're having problems with your weight or whatever, go see Myers. And I'm not a primary care doctor. I didn't sign up to be that, but I did sign up to be a healthcare provider.
Right.
Right.
Yeah. Let's talk about your goals.
I have my biggest goal is to try to get as many healthcare professionals bought into this. All right. I think that we have a deserved lack of trust from patients, and I think that if we want to change the country, the world, as far as metabolic health, it starts with us. It's hard to hear, you need to lose weight from somebody who needs to lose weight, right? And so understanding that you're in healthcare, you're a healthcare professional, you need to be healthy, and then the patients will listen, and they really listen if they know that you fought it too, that you weren't just born with a perfect health and you're just lucky and you can eat whatever you want. I mean, so when they see me and I start talking about this, I pull out my phone and I show them a picture of what I looked like, when I was sick.
Right, we're supposed to look at you all as you're the experts.
Right.
Right.
Would you go to a interior designer who was a hoarder? Would you go to a mechanic whose truck doesn't start and it's got flat tires? Mm-mm. No. So if you're in healthcare, you need to be healthy. Mm-hmm. That's my opinion, but I mean that's how we change it. And that's my goal is the healthcare professionals that I can reach understand that we need to be the example. Mm-hmm. Okay. And then the next goal is I want our hospital to be a safe space for insulin resistance and diabetes in our patients and for our staff.
Absolutely.
And then final goal is I want to lose the rest of my weight.
Right. So that, like when you first started losing weight, everybody was like coming to me and asking me if you were on that. Is he on the shot? Did he get weight loss surgery and such? So it was, no, you need to go talk to him about what he's doing. And it wasn't that at all, was it?
No.
Let's clear that up right now.
Yeah. No, I started losing weight I knew previously that if I did like Atkins or if I cut carbs out, that I could lose weight. But it was never sustaining because, I didn't know why. And it wasn't like I enjoyed it, I mean, I ate lean protein. I ate chicken, I ate turkey and whatever, and I ate vegetables, and I would eat nuts, and I would eat, a bunch of stuff. And I did not know that dietary fat, incorporating that made all the difference. I did not understand that. I thought that was to be avoided because that's what we were taught. That's what we were trained and taught, and I mean that's been beaten to me since I was a kid. Mm-hmm. I did not know that. So that made the difference between it being a diet to now this makes me feel good. I can't stress that enough that this is how I was supposed to be eating my entire life, and I didn't know it.
Mm-hmm. So years ago when I first got my certification as a coach, we were trained that we needed to make sure our clients got all these carbohydrates for energy. Would you explain how fat is being used for energy, that we don't need the carbohydrates like we've been taught all these years?
There is no such thing as an essential carbohydrate.
Exactly.
All right, that's the first thing. I make carbohydrates for my blood sugar on demand. My liver does that. Okay. Mm-hmm. All right. And so it takes fatty acids and converts that through gluconeogenesis. Mm-hmm. And so my blood sugar is perfectly regulated and I never eat carbs. Okay. There might be some, unintentionally that I might eat, but I definitely, I don't ever go out of the way to eat carbohydrates, and I have more energy now than I've had my entire adult life. So there are no essential carbs. There are essential fatty acids and amino acids, but there's no such thing as an essential carbohydrate. I don't eat carbs, never going to. And really where it all came together, it's just information on the internet, really good information though, from Dr. Ken Berry and Dr. Ben Bikman. Mm-hmm. But Ken Berry in particular, that guy, and I tell my patients, go on YouTube and watch his videos. His thing is proper human diet, and so I'm a big supporter of that, and I talk about that all the time. And proper human diet is a spectrum, okay? And if you are healthy and you're not trying to lose weight and you just want to stay healthy, you should be eating low carb. That's one part of the spectrum. That's 100 grams or less of carbohydrates a day, whole food carbs, not processed carb, ultra processed carbs. We're talking about, there's carbohydrates in the form of a potato or fruit or something like that. If you're trying to lose weight, you should be keto, all right? And then if you're trying to lose weight and inflammation, then you should be carnivore, Okay, carnivore is the lowest inflammatory, and then ketogenic style diet. So I like a little bit of vegetables, so I'm in between keto and carnivore. But I had severe inflammation, so I try to stay towards the carnivore end of it, and it's fixed all of my problems. But he's got a story like mine, but he's about 10 years ahead of me, and this is all he does now is just online, education. I think he's got a practice too, but by and large, his practice is just giving advice on YouTube about how to do proper human diet and understanding insulin resistance and understanding where, how to interpret the labs and all of the misconceptions about what's healthy to eat and what's not healthy to eat.
Right.
But I just love that guy, and I can't stress that enough. That's a guy you should follow, watch his videos, get his book. He's got a great book. It's awesome. Lies My Doctor Told Me. And then Ben Bikman he's more sciencey. He's a metabolic health researcher, and he's got a book called Why We Get Sick. And that one I read. That's when I really put it all together. I was like, oh, okay, that's why I had sleep apnea. That's why I had asthma. That's why I had reflux. That's why I had hypertension. And all of that's gone because I fixed the root of the problem.
I want you to give us a challenge. Give our viewers a challenge
All right.
today.
I want you to imagine that for you to be healthy, that you have to stack up a line of dominoes from here to the other side of town. And for that to happen, for you to get healthy, those dominoes have to fall uninterrupted. Okay? It takes 2 weeks to set that chain of dominoes up. And then once they're fallen, every domino that falls will undo a week's worth of damage. That's one domino is a day's worth of eating right. Okay? Proper human diet. However you want to look at that. My recommendation would be carnivore or keto, but anyway, some variant of the proper human diet, but no cheating whatsoever. And the issue is that first 2 weeks is hard because it's white knuckle drug withdrawal if you're on the standard American diet, right? But you have to fight hour by hour the first day. But you make it that first day, eating right, no setbacks, eat proper human diet, eat carnivore, eat keto, right? But fight that for every hour until you can make one day, and then do another day. And before you know it, you've made it a week. And then before you know it, you've made it 2 weeks. And now all of a sudden, you're not in this drug withdrawal because it feels impossible when you're first starting. But you got to fight it hour by hour and try to make it 30 days. If you can make that for 30 days, you will see such a substantial difference in your way you feel, and then just keep it going, right? And then if you can make it 90 days, you are now a totally different person. I just challenge you to fight it every hour, eat what you're supposed to eat and nothing else, and then make it through a day, make it through a week, make it through 2 weeks, make it through a month, and then try to make it the 90 days. If you can do that, you will save your life.
So that's the challenge. We got good stuff coming up in 2026. We've got Dr. Myers showing us how it's done.